This is NoWeedIllinois.com. I'm Monty Larrick. No Weed Illinois opposes the legalization of today's high-potency marijuana for recreational use, and we're offering a number of presentations with a variety of experts to make the argument against legalization. We're hoping you convey this information to your state lawmakers and will kindly ask them to vote no on marijuana. A vote could come as early as January. To contact your state lawmaker in Springfield, here's a phone number. It's 217-782-2000. I'm joined by Dr. Ken Finn, MD. He's board certified in physical medicine and rehabilitation and is certified in pain medicine and pain management. He serves on the American Board of Pain Medicine Executive Board. Dr. Finn has published several papers related to cannabis in the face of the opioid epidemic. Dr. Finn, I met with two state lawmakers a couple of days ago, and they seem to think that legalizing today's high-potency marijuana will help Illinois get a better handle on its opioid problem. Is that wishful thinking?
Yes, that's wishful thinking.
Why is that?
Well, I don't know if you want me to start my presentation or not, and I'll get to that, and hopefully by the end you'll understand and have some better answers.
All right, well, let's begin.
All right.
Okay.
Am I there?
Yes, you're there. Let's get started on the first question then. Is that wishful thinking for lawmakers to think that marijuana, today's high-potency marijuana, can really make an impact on the opioid crisis? What do you think?
Well, Colorado has had a medical marijuana program since 2001, and in 2017 we've had a record number of opioid overdose deaths, and those numbers have continued to rise over time, even after the advent of legalization. So in Colorado, it has done nothing but, in my opinion, contribute to the opioid epidemic rather than reverse it, because if it was a good substitution drug, we should have the lowest number of opioid overdose deaths, not the highest.
Not the highest. What about in other states like California and Washington State?
Well, I can't speak to the data in those other states. I was recently presenting in Utah, and they've already seen a decline in their opioid overdose deaths, and they don't even have a medical marijuana program. So whatever Utah is doing, they're doing a job without it.
Okay. Well, you have a presentation, and let's continue with that.
All right. I think it's important for folks to understand the endocannabinoid system, because I'm not going to negate the fact that there is an effect of marijuana on the body. And they do affect, or they interact at a level of receptors called the CB1 and the CB2 receptors. I think the take-home message would be that folks need to understand that there is an effect of marijuana in the body. The CB1 receptors are localized in the central nervous system, like the brain and the spinal cord. And it's very important to understand that marijuana is what we would describe as a centrally acting substance. It's like opioids, it's like alcohol. It has an effect on the body from a cognitive perspective. The CB2 receptors, I think the take-home message is that the effect of marijuana on the CB2 receptors, there's evidence that it may be an anti-inflammatory effect and can be helpful with what is described as neuropathic or nerve-related pain, or cancer pain. What I'd like to describe is kind of what does the medical literature say about the endocannabinoid system and the effect of marijuana in pain. This is a very important slide to look at. Why do people go to the doctor? And if you look at the National Ambulatory Medical Care Survey, a national survey, they have 20 diagnoses of why people go and see their physician. You have high blood pressure, you have diabetes, you have obesity, but in the top 20 diagnoses for a pain issue, there's lower back pain, there's knee pain, abdominal pain, and shoulder pain. Things that are not in the top 20 of why people go to the doctor are neuropathy, headache, fibromyalgia, seizures, cancer, the things that you hear about or would expect to be much more used with marijuana. I'm going to talk about what does the literature really say about the use of marijuana in pain. If you look at what's available in the current medical literature, there's an article that came out in the Journal of the American Medical Association in 2015 that looked at the use of cannabis in a variety of medical conditions, and I want to focus really on what does the science show for the use of marijuana in pain. So they did a very nice review of the literature, and they assessed chronic pain in about 28 studies and a total of about 2,500 people. That's a very important number to remember. About 2,500 people was really the foundation in the literature of the use of marijuana for pain. If you look at the detail of that particular study, almost half of them involved products that are not available in the U.S. Several more looked at what we describe as synthetic marijuana, like the Marinol that's been around since 1986 to help with cancer-related nausea, etc. Only one study looked at an edible, one looked at vaporized cannabis. But I think it's important to understand that particular study, which again is really the foundation of this report of use of marijuana for pain, more than half looked at things that we don't even have available to us. They did not really look at what we describe as dispensary cannabis. Over half of those studies were felt to have a high risk of bias. Like there was something that, it wasn't a very good medical study. Last year in 2017, the National Academies of Science, Engineering, and Medicine came out with another paper, which most people that I discuss this with very often refer to. There were a lot of authors. They were very respected institutions that did this study, and none of the authors actually had a background in pain medicine or anesthesia, which I found somewhat interesting. And they relied very heavily on that Journal of the American Medical Association article in terms of determining whether or not marijuana is good for pain. Again, about 2,500 people. They also agreed that most of the studies use things that aren't available here. And they also felt that most of the conditions that they used that for were cancer pain and nerve-related pain. Again, why do people go to the doctor to see for a pain problem? It's lower back pain, shoulder pain, abdominal pain, knee pain. There was actually nothing in the medical literature showing benefit in those common pain conditions. Despite that, they came up with the same conclusion that marijuana is great for chronic pain, which really was unfortunate because they didn't clarify. It might show evidence for nerve-related pain or cancer pain with products that are not available in the US or with synthetic marijuana, like Sesamet or Dronabinol.
Are you aware of any cases, doctor, where marijuana actually interfered with proper pain management?
Yes, and I'll get to that in a little bit. I mean, one of the reasons I got into this discussion is that as a practicing pain medicine physician for over 25 years, I was seeing a lot of patients being referred to me on very high doses of opiates, which is a whole other discussion and problem that we have. They were reporting very high levels of pain, and they were using marijuana for pain. So clinically, it didn't make any sense to me why these people were using both marijuana and high-dose opiates and were still having a lot of pain. So when the Annals of Internal Medicine came out with a follow-up paper that not many people are aware of, but they looked at the same literature that the National Academies paper looked at, and the same literature that the Journal of American Medical Association looked at, and they came up with the conclusion, like I'm describing, that in terms of the use of cannabinoids for pain, the literature is most promising in people that have nerve-related pain syndromes, cancer-related pain, but there's no literature out there showing benefit for the use of dispensary cannabis with common pain conditions. Again, why do people go to the doctor? Low back pain, shoulder pain, knee pain, abdominal pain. There's nothing in the literature showing benefit for those conditions. The College of Family Physicians of Canada looked at the same medical literature, and they mailed their recommendations to 30,000 of their physician members across the country of Canada. They looked at the same medical literature and came up with the same conclusions that I'm describing. And when it came to acute pain, headache, osteoarthritis, and back pain, they strongly recommended against using marijuana for pain. And the only things you can consider or should consider using a cannabinoid were with neuropathic pain or cancer pain. And in their recommendations, which is probably the first stab at anybody making guidelines for the use of marijuana in pain, they recommended if you're going to resort to it, use something like Sativex, which unfortunately we don't have access to that in the United States, or use a synthetic marijuana like Nabilone or Marinol, which no patient has ever asked me for that. And the problem in the day and age of big pharma is that would be considered an off-label use and would be probably very expensive. And again, the one thing that not a lot of people talk about is we don't encourage people to smoke anything. And the Canadians recommended no smoking as well. There was a nice, interesting study that looked at trauma. And it was a multi-center study. There were 4 centers in Colorado, 1 center in Texas, and they looked at about 260 car crashes over a 4-month period. And at the end of the day, what they found is that the chronic marijuana user had the most requirement for daily opioid analgesic. So why would people that are chronic users that are in a car accident that likely have pain, why are they using more opioid than those that are occasional users, which is higher than those that were non-users? And I'll get to some of the science and evidence as to why that may be in a minute. The ones that were using marijuana also tended to have a higher reported level of pain, which is kind of similar to what my clinical experience has been. These patients coming to me with a pain problem using marijuana on high-dose opioids and reporting high levels of pain. And that's been my experience for several years before this study actually came back. And the conclusion of this study is that chronic marijuana use may have a detrimental effect on dosing and the frequency of opioid administration in those people after trauma. And obviously there was more prevalent use of marijuana in Colorado than the 1 center that they had in Texas. And it was interesting because they felt that the marijuana use itself had a significant effect on management, and those patients had a greater consumption of narcotics. If marijuana was good for pain, it should be opposite, you would think.
Yep, you would think. Well, are there better alternatives than marijuana and opioids for dealing with chronic pain?
Yes, and there's a lot of if I'm trying to manage a patient that has a chronic pain condition, we use things like physical therapy, chiropractic care, acupuncture. A lot of these patients are depressed, so there's a mental health component to this. So sometimes the medication-assisted treatment for their psychological component of their pain can be very helpful. Most of the patients referred to me, I try to wean them off of their opioids rather than increase their opioids. And I think there are certain patients that may require chronic opioid therapy, but those patients need to be monitored pretty closely for aberrant behavior or misuse of their opioids. There was a very good study that came out of Australia earlier this year in Lancet, which is a very well-respected medical journal, and they followed about 1,500 patients over 4 years in patients with non-cancer pain that were given opioids. And what they found is that cannabis use was common in people with chronic non-cancer pain who had been prescribed opioids, but there was no evidence that the use improved their outcome. And the ones that used cannabis, similar to the prior studies, the ones that were using cannabis had higher levels of pain and were having more difficulty in self-managing their pain. So there was no evidence that cannabis use reduced the pain severity or had what we would describe as an opioid sparing effect. Those patients were not substituting their cannabis use for opioids, and actually they were using more.
Using more.
Yes.
It just doesn't seem right.
Well, I think there's some there's actually some physiologic reason to that. When you look at I was talking earlier about the receptors in the body that the cannabis and the cannabinoids work on. If you look at the opioid receptors and the cannabinoid receptors, and this is kind of the science-y part of my presentation, but I'll try to keep it very simple. Interestingly, those receptors for cannabinoids and opioids, they share very similar pharmacologic profiles. They actually work very similarly. They come from the same family of receptors, and they work very similarly. And they work on a lot of what we call neurotransmitters in the body that have effects on pain, depression, schizophrenia, etc. And there are some very good animal models that show like marijuana toxicity can be treated with something called naloxone or Narcan, which is the antidote for opioid overdose. And what they have found is that people, or even in animal models that are toxic or have high levels of marijuana or cannabinoids in their system and are experiencing some health effects to that, they can be treated with the antidote for opioids.
Okay. You want to continue with your presentation here?
Yes. I won't get into that. So again, earlier I described that if Colorado, that's had a medical marijuana program for 17 years, and the use of marijuana for chronic pain was the answer, why are our overdose deaths up and ahead of the national average? Here's a nice graph from the Colorado Department of Public Health and Environment over time. And if anybody can show me or prove to me in this graphic that came from the state where and how and why marijuana will fix Colorado's opioid epidemic, it's not there. This is a more current data from 2017. You can see I'm a very visual person. You can see the increase over time of opioids, non-opioids, and other types of drugs. The total's gone up. The Denver Post said earlier this year that our Colorado deaths are continuing to rise, and now we're having other issues. We have a resurgence of methamphetamine. We have a resurgence of cocaine opioid overdose deaths. And interestingly and coincidentally, it coincided with legalization.
Wow.
So,
well,
again,
is there any evidence then that you said a resurgence of heroin and cocaine and meth use, that they would, with legalization, switch to marijuana instead of heroin, cocaine, and meth?
There's no evidence of that. You would think that if marijuana was the answer to our drug problem that goes along with not only opioids but other illicit substances, if marijuana was the substitution for those, again, Colorado would have the lowest number of methamphetamine, heroin, and cocaine-related deaths. But we've had deaths from methamphetamine exploded, according to the Denver Post, and that's state data. This is a nice graphic looking at prescription opioids, heroin, cocaine, methamphetamine, and you can see after legalization in 2014, there was a slight decline in opioid overdose deaths, and everybody was like, well, look, now that we have legal marijuana, our opioid overdose deaths are going down. The problem with those particular studies is they didn't look at trends over time, and they didn't account for these other things that are increasing, like heroin and methamphetamine and cocaine. Here's the 2017 graph, and you can see that top line on prescription opioids, that dip in 2014, 15 to 16. But in 2017, again, Colorado had a record number of opioid overdose deaths. And again, we've had a medical marijuana program since 2001. So it has not shown to curb our opioid epidemic. Again, here's another graphic from the Colorado Department of Public Health and Environment. And again, I would love anybody to explain to me how, where, and why marijuana has helped our opioid overdose death. And I would be more than happy to refer this information to your legislators, because this is the evidence. Public opinion does not make good science, and I've already outlined some of the scientific evidence that marijuana does not help with common pain conditions. There's a big lawsuit against Big Pharma, Purdue, and this was a local article in the paper that stated hundreds of U.S. cities and counties are parties to this suit, claiming big-name manufacturers and distributors use deceptive advertising and marketing to overstate the benefits of blank. In this article, it was opioids, but you can substitute any substance you wish into that blank that would include marijuana and tobacco. Understates the risk of addiction. As a result, the suit says, governments have had to pay more for social services, law enforcement, and other government functions. So yeah, we have an opioid epidemic, but this is big tobacco 2.0 as it relates to marijuana. We didn't do a good job with tobacco. We have not done a good job with alcohol. We have not done a good job with opioids. I don't know how and why marijuana is going to be any different. They're following the same playbook as cigarettes and tobacco. You can look back in the early days of the asthma cigarettes, that is not recommended for children under 6 years old, and all of these cures of this elixirs for hangover, Sunday driving, etc. This is the same playbook. The cigarettes of joy, Viceroys, the dentist recommends these things, etc. So this is the 420 celebration. I think this might be University of Colorado several years ago. And the issue and the problem is that when you normalize substance use in another industry that is really addiction for profit, you're going to see more people using. And when you see more people using, you're going to run into more problems. There was a study that came out earlier this year that followed 33,000 people over time. And it was a very well done study looking at people that are using marijuana and opioids. And over a period of time, cannabis users were more likely than non-users to experience new onset opioid use disorder 3 years later. And the problem, and the one problem I have with this particular study, is that the products that they were using are way less potent than what's available now in Colorado and probably in other states. You're going to hear that this is not your grandfather's marijuana. I can tell you in Colorado, the products of 2018 are nowhere near what they were in 2014. This industry has evolved so rapidly in our state that these products and their potency has gone through the roof. I mean, they do have products that are pushing the 99% THC level at this time.
And THC is the stuff that gets you high.
That's the stuff that gets you high.
Okay.
So I'm going to explain a little bit about the Colorado's data, but before I do that, I wanted to explain that patients with chronic low back pain, which is one of the more common reasons people see their physician. There was a study that came out in evidence-based practice last year that showed, people with low back pain, does the use of inhaled cannabis reduce overall opioid use? That was the question they looked to answer. And they found that people that were using cannabis were more likely to meet the criteria for substance abuse disorders and more likely to be non-adherent with their prescription opioids.
Okay. For those who do use illegal opioids, is there any sufficient data showing that marijuana actually helps them stay clean?
No. Again, actually, there was another study that looked at people that were in an interdisciplinary pain rehab program. And they followed these patients over time and found that those patients that were using cannabis were at a higher risk for substance-related negative outcomes and were more likely to report a prior history of illicit substance use, alcohol use, and tobacco use.
And with all the talk about the opioid crisis, are doctors being pressured to cut off opioid medication in favor of alternatives such as marijuana?
No, I think in the face of the opioid crisis in Colorado, what I have found is that a lot of my colleagues are less likely to prescribe because they feel they're under the gun of the DEA and monitoring their prescriptions. The patients are well informed. I have a lot of patients that really are less inclined to receive or accept a prescription for an opioid because they're afraid they might overdose. So I think it's a lot of counseling of the patient. I mean, I don't like to give patients opioids. Again, I typically try to get them off of their opioids. But there are some patients that still require chronic opioid therapy, but they just need to be monitored. And if they do use cannabis instead of opioids, which in my experience, in my clinical practice, has been very, very rare. I have had a couple of patients that opted to use their cannabis and stop using their opioids. But a couple of them showed ongoing very high levels of pain, and it did not look like, even though they were off their opioids, that they had any impact on their pain using cannabis.
Is there danger, for instance, in Illinois, that if marijuana is legalized, more people will try to self-medicate to keep off opioids? What's the domino effect of that?
I think that's a very valid point, and that's probably another added layer of complexity when it comes to managing and evaluating patients, is that I have had in my own clinical practice patients that will come in, go to the marijuana dispensary that's legal, self-diagnose, self-manage, and self-treat themselves and their children with cannabis.
And they're not actually getting the help they need.
No, because they end up in my office.
They wind up in your office.
Yeah, there may be some out there that, I don't know, they may not see me, but the fact of the matter is that patients do utilize marijuana and self-diagnose and treat, although they come back in looking for opioids to help with their pain problem. You need to understand that cannabis use disorder is the number one diagnosis for adolescent substance use treatment at one of the psychiatric facilities at the University of Colorado. And of those kids that are getting treated for substance use disorder, more than 20% get their marijuana from their parent or a family member.
Okay. Now, you've got a slide up here that says Colorado's Medical Marijuana Registry. It sounds like it's very well regulated. Is that the case?
It's poorly regulated, in my opinion. And I'll get to that in a second. Just one other article I wanted to refer to in terms of the foundation of the use of marijuana for pain. The Journal of Addiction Medicine this year followed 57,000 people. Again, the number of people that the foundation of the use of marijuana for pain is about 2,500. This article looked at 57,000 people, and there was a significant association between medical marijuana use and then non-medical pain reliever use, non-medical stimulant and tranquilizer use. So there's that tie into methamphetamine, perhaps, or heroin. So I'm going to go to this registry. So this was the 420 celebration at Denver City Park. And that little haze that you see there on the picture is not the inversion or fog. It's a cloud of marijuana smoke. And I think you would be very hard pressed to find in this crowd of people anybody with a debilitating medical condition. And that's what happens when you throw a big party in Civic Park, is you have nobody left to clean it up except the people that my tax dollars pay for. If anybody is familiar with the National Organization to Reform Marijuana Laws, Keith Stroop was the president of that several years in the 70s, and was quoted as showing, "We will use medical marijuana as a red herring to give marijuana a good name." This has been in the works for many, many years. So,
Saul Alinsky-esque.
yes. So over in Colorado, if you were to recommend medical marijuana, 92% of these patients had the diagnosis of severe pain. There's only about 3% that have the diagnosis of seizure, and about 4% have the diagnosis of cancer. Again, why do people go to the doctor for a pain problem? It's low back pain, knee pain, shoulder pain, abdominal pain, and there's nothing in the medical literature to supports dispensary cannabis in those conditions. We have a lot of plant-based medications already. We have we have chemotherapeutic agents. We have heart agents. We have aspirin, comes from the bark of a tree. I mean, we have a lot of plant-based medications, and I don't want people to feel like I'm a nihilist. I think that if we have a molecule that follows FDA drug development protocols that has been proven and effective in a particular condition, I am all for it. The problem is that dispensary cannabis is a generic substance. There's a lot of things in dispensary cannabis, multiple compounds. There's contaminants, there are heavy metals, fungus, rodenticides, fungicides, pesticides, insecticides that can be on these products. And again, you mentioned whether or not we have a regulated system. I think they are folks in Colorado trying to do a good job, but our sheriff in our local community had more marijuana citations in the first 4 months of 2018 than all other crimes combined.
Well, why is that? If marijuana is legal?
Well, it's legal, it's medical, and people don't follow the rules. When I was in Utah last week, I was reading on their ballot initiative and their Proposition 2 that's coming up, and they say we're going to regulate it. We're going to it's going to be tightly restricted. Here are the rules of the game. And I hate to tell you, when you have an addiction for profit industry, they don't follow the rules. And all of these marijuana grows in Colorado are medical grows. They're not the recreational grows. These are people that get their medical marijuana card. They are allowed to grow 12 plants now. Previously, they were allowed to grow up to 99. But
99? Oh,
yes,
wow.
but in Colorado math, 12 or 99 equals 3, 4, or 600. And that's very, very common to have these illegal marijuana grows in our communities that have hundreds of plants.
Wow. And you talked about the chemicals that some of this recreational marijuana contains. We've heard from some other experts that those chemicals are actually harming the environment in Colorado.
Yes, and I'm gonna defer that to Dr. Gabriel, who I think is presenting tomorrow. He and I presented in San Diego last year, and his information is frightening, eye-opening, and I will leave that to him. I don't want to steal his thunder, but he's very, very well-informed on that environmental impact, and I'll leave that to him. But the Denver Public Health, on average, has had a recall of medical marijuana products on the average about once a month for the past 3 years. And so the problem is that there's no public service announcement regarding that. We hear about the Ritz crackers and the E. coli on the salads and the peanut butter on the news. It's all over the news. You know, throw this away. This chicken is bad, has E. coli or salmonella. But Denver Public Health has had recalls on a regular basis showing molds, pesticides, fungicides on products, and there's no public protection about that. They know, the Colorado Department of Public Health and Environment knows, but the public does not know. And even if you go to the Denver Public Health website, it's very, very hard to find, unless you know where you're going, where those recalls are.
Before we continue, Doctor, we need to reintroduce you. This is noweedillinois.com, and our special guest is Dr. Ken Finn, MD. He's certified in physical medicine and rehabilitation, and is certified in pain medicine and pain management. Go ahead, doctor. I'm sorry.
Oh, no problem. I'm just going to move on so we can cover some more information. In Colorado, the people that are behind the counter are called bud tenders. There's no medical requirement for them to have, there's no medical basis for their recommendations versus a pharmacist who are very, very smart and well-educated people that are required to have continuing education. The requirement for a bud tender is you need to be 21 years of age and have a pulse. You do not require any medical background whatsoever. They did a study at the University of Colorado earlier this year where 70% of the dispensaries across the state were recommending the use of marijuana for pregnant women. We don't have enough time to get into the problems that are associated with the developing fetal brain or the brain of an infant that's growing with mothers that are breastfeeding, etc. But that is in my opinion, practicing medicine without a license.
Do you ever foresee a time when these bud tenders will be located in a Walgreens, a CVS, etc.?
I don't foresee that time.
Really?
I don't. At least not here. It hasn't happened. I don't know what the restrictions may be for that, but if that happens, I'll probably move.
Okay. But that's a possibility, though, wouldn't you say?
I mean, I think anything's possible given what I know about what's happened in Colorado. I mean, they have products that you would never have thought of being developed on a regular basis. And again, the potency has gone through the roof. We're pushing the 95% plus THC concentration. And those high potent products have been associated with negative mental health consequences, including schizophrenia, psychosis. Levi Tamba, who was an exchange student from Africa, who was in Wyoming and came to Colorado on spring break, got a hold of a marijuana edible, which was a medical product. So number one, he was a minor. Number two, he didn't have a medical card. Number three, got his hands on a medical product, gobbled them all up, became psychotic, and jumped off a balcony and died from psychosis, marijuana-induced psychosis. So don't let anybody tell you that marijuana has never killed anybody. There's a lot of people that have had indirect cause of death related to marijuana use. People aren't normally going to overdose on it, but they might become psychotic and do something like jumping out a window.
Yet we have this image that the marijuana, at least for the marijuana from years gone by, helps mellow you out and helps you relax, etc.
Well, you know, the marijuana has been around for thousands of years. What is termed God's plant, I have nothing against God's plant marijuana that's been around for thousands of years, that the THC content is anywhere from 0.5 to 3%. That doesn't exist anymore in our state and doesn't exist in those states that have medical or recreational marijuana. This is a modified product that is, they've kind of bred the CBD or the less psychoactive component out of it. They have crystal forms of marijuana that are pushing 99% THC that are widely available. And unfortunately, our kids may have access to that. You know, every state I've spoken in and everybody I talked to agrees we don't want kids having access to marijuana. Did we do a good job with alcohol, tobacco? No. Kids will get their hands on it. If I would recommend anything, you need to cap the potency. Cap the potency. This is not God's plan. That doesn't really exist anymore.
But in Colorado, marijuana interests have blocked efforts to cap the potency.
Of course.
So it's safe to say that they'll try to do the same thing in Illinois.
They'll do it anywhere they can. There's actually a website called Weed Maps that will tell you where your closest marijuana store will be. And unfortunately, they are following the same playbook as the tobacco and alcohol industry. Where do you think they put these marijuana stores? They put them in poor communities of color that don't have a good socioeconomic basis. And that's where these stores are concentrated.
And you you said that if folks think that marijuana is a natural alternative to prescription drugs, they're looking in the wrong place, right?
Well, the problem is that a lot of these products have contaminants in them, and I'm going to get to that here in a sec, where people have died with a contaminated medical product that is supposedly natural, green, safe, and medicinal and herbal, because they're contaminated with something that shouldn't be on the plant or the product. And again, Denver Public Health has had recalls, but there's no public safety announcement to protect the public. I think Illinois really needs to protect the citizens of its state.
They do. You mentioned that a lot of people are medicating with marijuana by smoking it. And you touched on it, but that can't be good on your lungs. And, we've had this big campaign for decades now to stop smoking. So are we looking at another cancer crisis caused by smoking marijuana?
That is possible. These are unfiltered products that deposit 4 times as much tar in the lungs than cigarettes do. And they have the same types of carcinogens are found in marijuana smoke that is also found in tobacco smoke. So I think we don't know at this point. I mean, it really has not been tied to lung cancer, although there have been some reports of patients that have developed lung cancer that have never smoked cigarettes, but are chronic marijuana users. So I think the jury's out in that realm. But we've had tobacco for thousands of years. And I'm sure there were probably people that died of lung cancer back in the 1600s, 1700s. But the real problem became when there was mass marketing, commercialization, production of tobacco. That's when we developed the problem. And again, we're going down the same road in the marijuana world.
What about vaping marijuana?
Vaping marijuana, it gets rid of some of the contaminants, but a lot of those vaping products, that's a new epidemic now. With the vaping, I don't know if you're familiar with that. We don't like kids vaping. Kids are vaping in record numbers, and the issue, there's a tie into marijuana. There was a very nice study that came out recently that showed kids that vape are much more likely to move and use marijuana than kids that don't vape. So I think that they are going to go hand in hand.
And I've heard recently about wet lung disease as a result of vaping. You know anything about that?
I don't.
You don't? Okay. I don't either, but I've just kind of heard something around that line that it's bad for your lungs to vape. So, okay.
It is bad for your lungs. And some of those vaping products have heavy metals. They have arsenic, lead, mercury, those sorts of things have been found, especially in the flavored cartridges. But I'm not familiar with wet lung.
Okay.
I'm going to move on a little bit. I mean, some of the advertising that has been in the Denver Post. Here's go to the beer festival, show us your wristband and get a discount off your marijuana. Get some free marijuana, medical only. Get some discounts, big joints. This was in a local paper here where it says, renew your medical marijuana card today and that you will be reimbursed. We'll help you schedule a doctor's visit and reimburse your visit with, quote, medicine for the cost of your doctor visit. You have to keep in mind, this, by definition, in Colorado and other states that have medical marijuana, this is medicine. And this is something you have to understand. As a physician and a clinician, this is not medicine.
That looks a little scary.
I have a lot more. This thing has been spotted in Colorado Springs, where I live. It's called the rig. Again, keep in mind, by definition, this could be legal as medical marijuana. We don't have time to talk about the effects of pregnancy, breastfeeding, and lactation. That poor child, his outcomes, the data is showing, is going to be poor. We don't have dosing guidelines. You can do whatever you want with whatever you want at whatever potency and how often or you want and still be considered medical marijuana. So these are what people are most familiar with when it comes to marijuana in general. But this is what's available. That top picture is a 99% crystalline THC.
That doesn't look all natural.
Not natural at all. It's modified. It's pure. It's concentrated. Very high potency. I had a patient, again, this is just an anecdote, who moved from out of state to Colorado, and he had prior drug experience. And I asked him if he ever dabbed marijuana. And I don't know if you're familiar with dabbing.
Well, tell us what that is. I'm sorry.
It's basically vaporizing high potency products, marijuana products, and inhaling the vapors. And depending on what you read, it could be the equivalent of anywhere from 30 to 60 joints at a time. And I asked him if he did that before, and he told me one time. And I asked him why he hasn't done it more. And he told me it reminded him of how he felt when he used to do crack cocaine. Again, anecdote, not science, but a very interesting. And this is not natural marijuana either. You have these products. I mean, in Colorado, you can walk around with 2 ounces of marijuana in your pocket, which could be about 100 joints, or you can walk around with 1 or 2 ounces of oil in your pocket. It's not going to be as apparent, but if you want to do the equivalent of a dose of marijuana, which is about 10 milligrams, that's the number of edibles you have in an ounce of hash oil.
Could you go back to that previous slide?
Yep.
The one in the middle, the edibles.
Yeah.
Looks like gummy bears to me.
Yes, and there was actually there was a TV station that did a little very non-medical study and had these types of products on a table and asked children to determine which one was the real one and which one was the medical one. And they couldn't identify or distinguish between the two because they look very, very much alike.
Wow. And it's just adults that are using those, right?
Absolutely not. There was actually last week there was a woman convicted of neglect of her 6-week-old baby who died because she used marijuana chronically throughout her pregnancy. She used marijuana while breastfeeding and was feeding her infant what they called gummies. I don't know what 6-week-old can eat gummies, number one. And that infant passed away from neglect and starvation and malnutrition and tested positive for marijuana.
That's just horrible.
Well, that train is stopping in Illinois if it already hasn't stopped. There was actually a psychiatrist in Illinois that was attacked by a patient last week that I read about because he was psychotic and she wouldn't give him a medical marijuana card. And so he branded a knife and attacked her, and she suffered some lacerations but didn't die, thankfully. But she was, this young man was apparently psychotic and wanted medical marijuana.
Well, let's proceed here.
So Denver Post, they make recommendations. They were in the Cannabis, which was a section of the Post, which is readily accessible to children if you get the newspaper. In the left side says it will treat stress, insomnia, pain, depression, and headaches with zero scientific basis. We asked them to provide the information regarding this particular strain, this Deadhead OG strain, and how and why it treats these medical conditions, and they didn't respond. This is used with permission from the Fremont County Sheriff's Office. It was a result of a police investigation that had nothing to do with marijuana. However, in the process of the investigation, this found the Polaroid of an infant with an adult holding fully loaded, locked marijuana pipe to the baby's face. This is what happens when you normalize drug use. The perception of harm is going down, therefore the use is going up. We had the same issue with tobacco, but we've done a very good job with anti-smoking campaigns. We see the public service announcements that Philip Morris has to do this commercial about, smoking's bad for you. So the use has gone down of things like cigarettes. But in marijuana, the opposite has been true because they're marketing, producing, advertising that it's safe, it's natural, it's herbal, it's medicinal. And this is what happens when you normalize drug use.
So 10 years down the road, we're going to have a similar public awareness campaign like we did for tobacco for marijuana.
And opioids and alcohol. I mean, we haven't done a good job with those. However, I would think we're smarter than that. I would think that we should have learned from our prior mistakes with other addictive substances. Marijuana is an addictive substance, and especially with these high potency products. You're going to run down this road of normalizing use, increasing use, and with increasing use will come increasing problems with drug driving, impaired driving, adolescent use and addiction, environmental impacts, just to name a few. There's plenty.
Yep.
People talk about the CBD, the products that are for CBD, which is the non-psychoactive component. It's safer. It's not going to get you high. But I have patients that talk to me about CBD, and my response to them is buyer beware, because you don't know what's in the product. There were two studies that came out, again, the Journal of American Medical Association, so a very well-respected medical journal. Because CBD is online, it's legal in all 50 states, which isn't necessarily true. And they purchased 84 products online, and they tested them. 43% were under-labeled with CBD product, 26% were over-labeled with CBD content, and 21% actually had THC in it, which is federally illegal. They did a follow-up study, and they went into, quote, regulated markets in California and Washington. So again, these states have rules, they have regulations, they have, we're going to tightly restrict it, when kids aren't going to use it, and we're going to monitor the products. So these people followed up with a study, and they looked at 75 products in regulated markets in Seattle and San Francisco. 17% were accurately labeled with respect to THC content, and only 59% had detectable levels of CBD.
Okay. Well, you talk about the regulation, and the lawmakers I've spoken with about this just this week said, you know what, if we bring this to Illinois, it will be tightly regulated, and it will be for just people 21 and over. And you're saying,
good luck.
No way, Jose. Yeah.
Good luck. They actually did a study of products in California. Let me see if I can find that. It's not here yet. They did a study in California just on 9/11. Nearly 20% of all the products in California failed testing for potency and purity. They found pesticides, solvents, molds, bacteria, including E. coli and salmonella, and the THC content was most often cited the source of failure. California's had a medical program since the late 90s and just recently regulated it. They're doing a terrible job. So why is Illinois going to do a better job than California, Washington, Oregon, Colorado? They're not. I laugh at these rules because, yeah, they're going to put black and white in there, and they're going to say, we're going to follow these rules. Good luck. They haven't done it in Colorado for certain. Our sheriff, that's all they do these days is bust all the illegal marijuana activity and these cartels that are coming from all over the world.
You have a picture here of some people standing outside of a Walmart. What is that?
Well, this is in Pueblo, where Dr. Randall, who gave a presentation yesterday, lives. And these people that are the homeless folks in Pueblo are very honest of why they are there. They are there for marijuana. And this is a picture outside the Walmart in Pueblo. This is the San Isabel Forest, which is a national forest down outside of Pueblo. One of the first responders we know went into the forest and took these pictures of all of the illegal marijuana plants in the national forest. I was evacuated for 8 days in 2012 for the Waldo Canyon fire. And this is pre-legalization. And after that fire was out, they found a 20-acre illegal marijuana grow in the national forest, complete with housing quarters and irrigation lines. And since legalization, the amount of marijuana that's been taken out of Colorado's national forest has increased by over 2,000%. It's everywhere in our forests.
Okay. Well, someone who is tuned in doesn't quite understand what CBD is. Could you explain that once again?
CBD is cannabidiol. It's the non-psychoactive component of the plant. It's not going to get you high. It's the product that has been used to treat seizure, pediatric seizure, very narrow spectrum of seizure disorder. So that's what CBD is. And everybody, they talk about the CBD, and it's very important to understand. Even, the FDA approved Epidiolex, which is a purified, free of contaminants plant product. It's natural. It's not synthetic, to treat pediatric seizure, very narrow window pediatric seizure. And it's not going to get you high. However, if you go to the Epidiolex website and you look at side effects and you look at drug interactions, there are significant precautions for this non-psychoactive component, particularly liver. This can affect the liver, and they do recommend that any patient that has a seizure that is started on Epidiolex, you get baseline liver tests and you follow their liver function very closely. CBD, although is not psychoactive, is not free of side effects. There's drug interactions, like people on Coumadin or a blood thinner that are taking CBD have a risk of increasing their what's called an INR, so their blood can become more thin when they're using those in combination. So there's a lot of information that the general public and even my medical colleagues don't know. I presented this information at an orthopedic conference last weekend, and more than 90% of the people in the audience had no idea that this is out there, that this evidence is there. So I think CBD, non-psychoactive, cannabidiol, there are products available for those kids that have pediatric seizure, and it should be readily available to those kids. And again, I don't have a problem with a natural cannabinoid that's purified, tested, and proven to be effective. I'm all for it. Okay.
We have just a few more minutes if you want to continue with your presentation here.
Sure. This is a toxicology report from the Colorado Department of Public Health and Environment, their vital statistics. Marijuana is the most prevalent substance found in Colorado teen suicide. Why is that? I mean, our children are not overdosing on marijuana, but it is the most prevalent substance found in kids 12 to 19 in Colorado that kill themselves. It brings up several issues. Number one, why are kids getting their hands on it, number one? Number two, I spoke to the coroner, and they usually test the urine rather than blood in a teen suicide. And the fact that the urine is positive tells me these kids are chronic users. They're not just one and done or a casual user, because it's present in their urine, which may have indicated they used a week or two prior or so. But it's the most prevalent substance found in teen suicide, and that's the number of, or the volume of all age groups across Colorado where marijuana is present when people kill themselves. It's skyrocketing. And the relationship between marijuana use and mental health is very, very strong in the medical literature.
Okay. Wow. That didn't end well. And no. Marijuana's involved.
Oh, this one?
Yeah.
Well, I don't know. This was just this is just to illustrate impaired driving. We've had an increase in marijuana-related fatalities. People talk about, was it caused by impaired driving? Hard to say. All we can say is that over time, the number of people dying on our highways that have marijuana present is going through the roof. Here's a nice little graphic over time. It's not going down, it's going up. Percent of all traffic deaths that were marijuana when a driver tested positive for marijuana. People, they combine stuff. They use marijuana, tobacco, marijuana, other drugs. But there's a significant percent that don't have that just use marijuana that end up in a fatality. This is a scary statistic that came from the Colorado Department of Transportation, looking at people in Colorado that admit to driving high or getting behind the wheel within 2 hours of using is fairly significant, 70%.
Wow.
And then people that work in the industry, if you look at, it's a very interesting story. The American Journal of Industrial Medicine recently shows that people that work in the industry very commonly use before, during, and after work. So again, do you want the bud tender behind the counter telling you or advising you on use of a product for a particular medical condition when the chances are they may have been using marijuana before they got to work.
Yeah. And then they're driving home from work.
And then the drive. I can't tell you, I have seen people light up a bowl of marijuana on I-25 going 70 miles an hour, driving with their elbow while they light up their pipe. I've seen it.
Yeah. Is it a safe bet that Illinois roads will become more dangerous if lawmakers legalize today's high potency marijuana?
Absolutely. No question in my mind. You talk to any law enforcement in Colorado, they say this has been a disaster for our roads.
Okay.
There's this, if you want to take a picture of this, there was a conference I organized last year. I mean, the issue just goes far beyond, apparently, just the use or non-use of marijuana for pain disorder. I organized a conference last year that went from 8 a.m. to 5 p.m. We had a keynote speaker during lunch, and we still could not touch on all the issues.
That's amazing. Amazing.
So just kind of in summary, I mean, I think that, again, their cannabinoids may have therapeutic benefit. I'm not a nihilist. The science shows that the most benefit is with cancer pain or nerve-related pain, with products that are not available, or with synthetics. There's no accepted literature showing the use of cannabinoids in common pain conditions with dispensary cannabis. Opioids and cannabinoids work very similarly. They govern some of the same central nervous system neurotransmitters, which is the communication between the nerves. And we have not yet been able to show or demonstrate an impact on the opioid epidemic in Colorado. So I think we need to take these blinders off and say this really isn't about pediatric seizures or use of marijuana in pain. We have all these other problems that we're starting to see. The amount of emergency room visits are going up, which is a healthcare cost. I mean, I published a paper that in my community between 2009 and 2014, that one hospital lost $20 million in healthcare dollars related to, or just from marijuana-related ER visits. So this comes with a price tag. You're going to hear about, we're going to make a lot of money, but just like alcohol and tobacco, which make a lot of money for their respective industries, we know has a significant societal cost that goes well beyond the revenue generated. This is no different, and it's showing that to be the case. So I think I support doing the studies to show or prove whether or not a cannabinoid is effective in a chronic pain condition. And we need consistent delivery systems. We need limits on potency, because people can dose with whatever, whenever, however, with a wide spectrum of potencies whenever they want. So I'm fine with a science-based, plant-based, FDA-approved, regulated, purified cannabinoid, such as Epidiolex or Sativex. There you go.
All right. Well, thanks so much. Dr. Ken Finn, MD, board certified in physical medicine and rehabilitation and certified in pain medicine and pain management. Is there some contact information for you? And if people would like more information about what you had to say today?
Sure. My email is kfinn@springsrehab.net. That's kfinn, F-I-N-N, at springs, SPRINGSREHAB.net.
Doctor, one final question. What message should Illinois voters be telling their lawmakers about legalizing recreational marijuana?
Not yet. Put the brakes on, do the studies, prove it. Again, I'm not against a cannabinoid that helps for pain, but I think that Colorado's really run into a lot of issues that other states really need to learn from before you put it to the public vote.
All right. Thank you so much, Dr. Finn. God bless you.
Thank you.
All right. And thank you for tuning in. This is NoWeedIllinois.com. Monty Larrick here. Be sure to tune in next time. And be sure to contact your state lawmakers about the recreational use of marijuana. We're encouraging a no vote on marijuana. If you'd like to contact your state lawmakers, you can call 217-782-2000. Thank you. God bless.